If you're over 60 and experiencing problems with your urinary tract health, your daily habits may be contributing to this situation in unexpected ways. Urologists are highlighting 5 common habits frequently seen in older men that increase the risk of urinary tract infections. Recognizing and changing these habits can help improve your urinary tract health and enhance your quality of life. Research shows that approximately 1 in 5 men over the age of 60 will experience urinary tract issues, with this number increasing significantly with each subsequent decade. While many attribute these problems solely to prostate changes, daily habits play a surprisingly significant role in urinary health. Yet what many men don't realize is that certain everyday behaviors can compromise the body's natural defenses against urinary infections, or irritate the urinary tract in ways that increase vulnerability to problems. What's particularly concerning is that some of these habits may seem unrelated to urinary health, or might even be practices you've adopted with good intentions for your overall health. Let us know where you're watching from and how old you are in the comments below. The connection between certain daily habits and urinary tract health has gained increasing attention from urologists who specialize in geriatric urology. What's consistent across these specialists' observations is that making targeted lifestyle adjustments can significantly reduce infection risk and improve overall urinary comfort, even for men who have experienced repeated issues. When urologists first began investigating the patterns associated with recurrent urinary tract infections in older men, many were surprised to discover how significantly certain habits influenced infection susceptibility. However, as our understanding of the urinary microbiome and age-related changes to the urinary system has advanced, the mechanisms behind these connections have become clearer. I'm Dr. Rachel, and for over 25 years, I've specialized in urology with a focus on geriatric urinary health. Today I'll share information about 5 common habits that may be negatively impacting your urinary tract health. Habits that, when modified, might help reduce your risk of uncomfortable infections and support better urinary function. Before we explore these habits, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to healthy aging focused on practical, accessible strategies. If you're interested in ways to potentially support your urinary health and overall well-being as you age, you won't want to miss our upcoming videos. These habits are worth examining because they affect the core protective mechanisms that help prevent urinary tract infections, particularly urine flow, hydration status, bacterial balance, and the integrity of the urinary tract lining. To understand why these habits matter, let's first look at how the urinary system changes with age and becomes more vulnerable to infection. As men age, several factors naturally increase susceptibility to urinary tract infections. Prostate enlargement, which affects most men over 60, can obstruct urine flow and prevent complete emptying of the bladder. This retained urine creates an environment where bacteria can multiply. Additionally, the immune system generally becomes less efficient with age, reducing the body's ability to fight infections. The bladder muscle may weaken, further contributing to incomplete emptying. And hormonal changes can alter the urinary tract environment in ways that affect its natural defenses. These age-related changes mean that habits that might have had minimal impact on urinary health in younger years can become significant risk factors after 60. With this understanding, let's examine the 5 habits that urologists have identified as particularly problematic for urinary tract health in older men. The 5 problematic habits affecting urinary health. The first habit that may be negatively affecting your urinary tract health is inadequate hydration, particularly during specific times of day. While general dehydration is widely recognized as problematic, the pattern of fluid consumption throughout the day is equally important for urinary health in older men. Many men over 60 deliberately restrict fluids in the evening to avoid nighttime urination, which is understandable given how disruptive nocturia, nighttime urination, can be to sleep. However, this practice can concentrate urine during overnight hours, creating an environment where bacteria are more likely to thrive. Concentrated urine is more irritating to the bladder lining and contains fewer of the natural flushing mechanisms that help clear bacteria. Additionally, some men develop the habit of holding it for extended periods during the day due to inconvenient timing, mobility issues, or concerns about finding accessible restrooms when away from home. This prolonged retention allows bacteria more time to multiply in the bladder and can gradually stretch and weaken the bladder muscle over time. The solution isn't simply to drink more fluid, but to optimize the timing of fluid intake. Urologists typically recommend that men over 60 consume the majority of their daily fluids, about 1.5 to 2 liters, earlier in the day, morning through mid-afternoon. This approach helps ensure adequate hydration and regular flushing of the urinary system, while minimizing nighttime bathroom trips. Additionally, establishing regular urination habits, typically every 3 to 4 hours during waking hours, helps prevent prolonged stagnation of urine in the bladder. Some men find it helpful to use time voiding, where they urinate on a schedule rather than waiting for a strong urge, which might come too late for optimal bladder emptying. The second habit that might be compromising your urinary tract health is excessive consumption of bladder irritants, particularly certain beverages that can affect the bladder lining and bacterial environment. Many men are unaware of how significantly these substances can impact urinary comfort and infection risk. Caffeine is a primary concern, as it acts as both a diuretic and a bladder irritant. Coffee, tea, and cola beverages can increase urinary frequency and urgency, while potentially irritating the bladder lining, making it more susceptible to bacterial adherence. For men with existing urinary sensitivity or enlarged prostates, these effects can be particularly problematic. Alcohol similarly acts as both a diuretic and irritant, with additional effects on the prostate that can temporarily increase swelling and urinary obstruction. Even moderate alcohol consumption, especially in the evening hours, can significantly affect nighttime urinary symptoms and increase infection vulnerability. Artificial sweeteners, particularly those found in diet sodas and processed foods, have been identified as bladder irritants for many individuals. Research suggests they may alter the urinary microbiome, the balance of bacteria in the urinary tract, in ways that increase infection susceptibility. Acidic beverages like citrus juices and carbonated drinks can also irritate the bladder lining in sensitive individuals, creating an environment where bacteria may more easily adhere and multiply. This effect varies between individuals, but becomes more common with advancing age as the bladder tissue naturally thins. Urologists typically don't recommend completely eliminating all potential irritants, as this approach is often too restrictive. Instead, they suggest a personalized elimination trial, systematically reducing consumption of suspected irritants for 1 to 2 weeks, then gradually reintroducing them while monitoring symptoms. Many men discover that moderate consumption earlier in the day is tolerable, while evening consumption of the same substances significantly impacts symptoms. The third habit that may be affecting your urinary tract health is improper bathroom hygiene and toileting practices. While this topic may be uncomfortable to discuss, urologists consistently identify certain bathroom habits that increase infection risk, particularly in older men. Incomplete emptying of the bladder is a primary concern. Many men, particularly those with prostate enlargement, don't take sufficient time to ensure complete bladder emptying. Rushing the process, especially when in public restrooms, can leave residual urine in the bladder that becomes a growth medium for bacteria. Taking an extra 30 to 60 seconds to ensure complete emptying, even when you feel done, can significantly reduce infection risk. Post-urination hygiene also matters more than many men realize. Research has shown that bacteria from the rectum can colonize the urethra, particularly in older men with decreased mobility, who may have difficulty with thorough cleaning. Using toilet paper to wipe the urethral opening after urination, moving from front to back, can help reduce bacterial transfer. For men who experience post-void dribbling, small urine leaks after completing urination, proper management of this issue is important for both comfort and infection prevention. Simple techniques like gently pressing on the perineum, the area between the scrotum and rectum, after urination to express remaining urine from the urethra, or performing several pelvic floor contractions, can help minimize this common problem. Additionally, clothing choices can impact urinary tract health. Tight-fitting underwear and pants can increase perspiration and bacterial growth in the genital area, potentially increasing infection risk. Cotton underwear that provides room for air circulation is generally recommended by urologists for men prone to urinary issues. Robert, a 72-year-old who had experienced recurring urinary tract infections, discovered that his bathroom habits were contributing to his problems. I was always in a hurry in the bathroom and rarely took the time to ensure I'd completely emptied my bladder, he explains. My urologist suggested I spend more time. Actually count to 30 after I think I'm finished, and implement some simple hygiene practices. After making these changes, Robert experienced a significant reduction in infection frequency. I haven't had an infection in over 8 months, compared to having them every few weeks before. Such a simple change made such a dramatic difference in my quality of life. I wish I'd known about this years ago. What surprised Robert most was learning about post-void dribbling management. No one had ever explained that this common issue could be managed with simple techniques. Learning to press on the perineum after urinating has virtually eliminated the embarrassing dribbling problem I'd been experiencing for years. The fourth habit that might be compromising your urinary tract health is sedentary behavior, particularly prolonged sitting without movement breaks. While the connection between physical activity and urinary health might seem tenuous, research has revealed significant links that are especially relevant for men over 60. Extended periods of sitting create pressure on the prostate and bladder, potentially contributing to urinary stagnation and incomplete emptying. This pressure effect is most pronounced in men who sit for more than 2 to 3 hours without standing or walking breaks. For men with enlarged prostates, this sitting-induced pressure can exacerbate obstruction and retention issues. Additionally, sedentary behavior affects overall circulation, including blood flow to the pelvic region. Reduced circulation can impact tissue health throughout the urinary system, and may slow healing processes when irritation or minor infection occurs. Regular movement helps maintain healthy blood flow to these tissues. Perhaps most significantly, regular physical activity helps maintain the strength of the pelvic floor muscles, which play crucial roles in bladder control and complete emptying. These muscles naturally weaken with age, but this process accelerates with inactivity. Conversely, even modest increases in physical activity can help maintain or improve pelvic muscle function. Urologists typically recommend breaking up sitting time with brief movement breaks every 60 to 90 minutes. Simply standing, walking briefly, or doing a few simple exercises can help reduce prostate pressure and improve circulation. Additionally, incorporating regular walking, aiming for 30 minutes daily, which can be divided into shorter segments, provides significant benefits for overall urinary health. For men with limited mobility, even small movements can help. Chair exercises, standing periodically, or simple stretching can provide benefits compared to continuous sitting. The consistency of movement breaks throughout the day appears more important than the intensity of the activity for urinary health benefits. The fifth habit that may be negatively affecting your urinary tract health is improper management of other health conditions and medications, particularly those that indirectly impact urinary function. Many men are unaware of how significantly other aspects of their health regimen can affect their urinary system. Poorly managed diabetes substantially increases urinary tract infection risk, as elevated blood sugar creates an environment where bacteria thrive both in the urinary tract and throughout the body. Additionally, diabetic neuropathy can affect bladder sensation and function, potentially leading to incomplete emptying. Maintaining good glycemic control can significantly reduce these risks. Certain medications, while necessary for other conditions, may affect urinary health as a side effect. Some blood pressure medications can reduce urinary flow, while others increase urination frequency. Certain antihistamines, antidepressants, and pain medications can reduce bladder sensitivity or impair complete emptying. Some medications cause dry mouth, leading to reduced fluid intake and subsequent urinary concentration. The timing of medication can also impact urinary health. Taking diuretics, water pills, in the evening, for example, significantly increases nighttime urination, which can lead to sleep disruption and subsequent fluid restriction that concentrates urine. Additionally, some men self-medicate with over-the-counter products without recognizing their potential urinary effects. Decongestants often used for colds can affect urinary flow. While some herbal supplements marketed for prostate health may interact with prescription medications or have unexpected effects on the urinary system, urologists recommend a comprehensive medication review with your healthcare providers, specifically discussing any urinary symptoms you're experiencing. Often, simple adjustments to medication type, dosage, or timing can significantly improve urinary health without compromising treatment of other conditions. It's also important to disclose all supplements and over-the-counter medications, as these can have significant effects that many healthcare providers might not consider without specific prompting. Thomas, a 68-year-old with hypertension and occasional urinary issues, found that medication timing was a key factor in his symptoms. I was taking my blood pressure medication, which included a diuretic, right before bed because I was worried about daytime bathroom trips while I was out, he shares. My urologist suggested I take it in the morning instead, and the difference was remarkable. After changing his medication schedule and implementing other recommendations, Thomas experienced significant improvement. Not only did my nighttime urination decrease from 4 to 5 times to just once or twice, but I also stopped having the burning sensation I'd occasionally experience. I'm sleeping better, which makes everything in life more manageable. What Thomas found particularly valuable was the comprehensive approach his urologist suggested. It wasn't just one change, but looking at all these different habits together. The combination of better hydration timing, medication adjustment, and more movement throughout my day created improvements beyond what I expected was possible. Let us know where you're watching from and how old you are in the comments below. While addressing these 5 main habits provides a good foundation for urinary tract health, there are several additional considerations that might be relevant depending on your particular situation. These targeted modifications might be worth discussing with your healthcare provider. Additional considerations for urinary health. For men experiencing recurrent infections despite addressing the habits we've discussed, some urologists recommend daily cranberry supplements, capsules rather than sugary juices, for their potential anti-adhesion properties that may help prevent bacteria from attaching to the urinary tract lining. The research on cranberry is mixed, but some studies suggest benefits, particularly for those with recurring infections. For those with reduced mobility that makes hygiene challenging, adaptive equipment like long-handled wipers or bidet toilet attachments can help maintain cleanliness with less physical strain. These tools can be particularly valuable for men with arthritis, back problems, or other conditions that limit flexibility. For men who must take medications that affect urinary function, discussing compensatory strategies with your healthcare providers can be beneficial. For example, if you take a medication that tends to reduce bladder sensitivity, implementing timed voiding, urinating on a schedule rather than waiting for the sensation, might help prevent overflow and retention issues. James, a 74-year-old with mobility limitations due to arthritis, found that a combination of adaptive equipment and strategic habit changes significantly improved his urinary health. Using a bidet attachment and implementing regular movement breaks, even though my mobility is limited, has made a tremendous difference, he explains. I went from having 2 infections in 3 months to no infections for over a year now. What James appreciated most was learning approaches that worked within his physical limitations. My doctor helped me develop strategies that acknowledged my arthritis, while still improving my urinary health. I didn't have to make drastic changes that weren't sustainable for me, just thoughtful modifications that worked with my situation. The science behind urinary tract infections in older men. The recommendations for these habit modifications are supported by our understanding of how urinary tract infections develop and the specific vulnerabilities that increase with age. Understanding these mechanisms can help motivate consistent implementation of protective habits. Urinary tract infections occur when bacteria, most commonly from the digestive tract, enter the urinary system and multiply. In younger men, such infections are relatively rare because of the length of the male urethra, the antibacterial properties of prostatic fluid, and generally efficient bladder emptying. However, these protective factors often diminish with age. Prostate enlargement, which affects approximately 50% of men in their 60s and up to 90% of men in their 70s and 80s, creates urinary flow obstruction that can prevent complete bladder emptying. This retained urine becomes a medium for bacterial growth, significantly increasing infection risk. Additionally, age-related changes to the immune system, known as immunosenescence, reduce the body's ability to recognize and fight bacterial invaders. This immune decline makes infections more likely to develop once bacteria enter the urinary tract. Research has also revealed changes to the urinary microbiome with age, the community of bacteria that naturally inhabit the urinary tract. A healthy microbiome includes beneficial bacteria that help prevent harmful bacteria from gaining a foothold, similar to the concept of gut microbiome. Habits like inadequate hydration, consumption of bladder irritants, and certain medications can disrupt this protective bacterial balance. Now, I want to share what might be the most important factor for maintaining urinary tract health, something that urologists consistently emphasize. The key factor appears to be consistency in preventive habits rather than reactive management once problems develop. While antibiotics effectively treat established infections, repeated courses of antibiotics can create resistance and disrupt the body's natural bacterial balance. Focusing on consistent preventive habits helps maintain the urinary tract's natural defenses and reduces reliance on antibiotic treatments. It's also important to recognize that these habit changes often require some personalization based on your specific health conditions, medications, and lifestyle factors. Working with healthcare providers who understand the complexities of geriatric urinary health can help you develop a personalized prevention strategy that addresses your particular risk factors. Michael, a 79-year-old who had experienced multiple urinary tract infections, emphasized the importance of this consistent, personalized approach. After my third infection in 6 months, my doctor helped me develop a comprehensive prevention plan based on my specific situation, he shares. Rather than just treating each infection as it occurred, we focused on preventing them from developing in the first place. After implementing his personalized prevention strategy, Michael experienced a dramatic improvement. I haven't had an infection in over 18 months now. The combination of properly timed hydration, regular movement despite my limited mobility, and careful attention to bathroom habits has transformed my quality of life. What Michael found most valuable was reclaiming his confidence. The constant worry about developing another infection was almost as debilitating as the infections themselves. Now I have the knowledge and habits to protect my health, which gives me tremendous peace of mind. For those concerned about urinary tract health, I recommend discussing these habit modifications with your healthcare provider, particularly if you've experienced recurrent infections or have other health conditions that might affect your urinary system. A personalized approach that considers your specific situation will be most effective. Remember that urinary tract infections in older men often require more aggressive evaluation than in younger men, as they can sometimes indicate underlying issues that need attention. Don't hesitate to seek medical care for symptoms like burning during urination, increased frequency or urgency, cloudy or bloody urine, or lower abdominal pain, especially if accompanied by fever, which could indicate a more serious kidney infection. It's worth noting that while these habit modifications can significantly reduce infection risk, they don't replace appropriate medical care when infections do occur. Urinary tract infections in older men should be promptly treated to prevent complications, including potential spread to the kidneys or bloodstream. Let's summarize the 5 habits that may be negatively affecting your urinary tract health. Inadequate or poorly timed hydration, which concentrates urine and reduces the natural flushing of the urinary system. Optimizing fluid intake timing and maintaining regular urination habits can significantly reduce infection risk. Excessive consumption of bladder irritants like caffeine, alcohol, artificial sweeteners, and acidic beverages, which can irritate the bladder lining and alter the urinary microbiome. Identifying personal triggers and moderating consumption can improve urinary comfort and reduce vulnerability. Improper bathroom hygiene and toileting practices, including rushing urination, inadequate cleaning, and failure to manage post-void dribbling. Taking time for complete emptying and implementing simple hygiene practices can substantially reduce infection risk. Sedentary behavior, particularly prolonged sitting without movement breaks, which creates pressure on the prostate and bladder, while reducing pelvic circulation. Regular movement throughout the day helps maintain healthy blood flow and reduces urinary stagnation. Improper management of other health conditions and medications, particularly those that indirectly affect urinary function. Working with your healthcare providers to optimize medication timing and manage conditions like diabetes can significantly improve urinary health. By understanding and modifying these habits, you may be able to substantially reduce your risk of urinary tract infections and improve your overall urinary comfort. While age-related changes to the urinary system are inevitable, these targeted lifestyle adjustments can help maintain optimal function and prevent many common urinary problems. If you found this information valuable, please consider sharing this video with others who might benefit. Many men experience urinary tract issues as they age, but are unaware of how significantly their daily habits might be contributing to these problems. Subscribe to our channel for more evidence-based approaches to healthy aging, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for older adults, always focused on practical, accessible strategies. Thank you for joining me today. I wish you excellent health in the years ahead. Until next time, take good care of yourself.